Hello everyone, my name is Ann Eads-Wadding and this is my strategic planning video for Business 428 Strategic Management and Marketing in Healthcare for Liberty University Online. I have chosen the topic of the Ozempic injection pen because this product is one that I have personal knowledge of and experience. Did you know that according to the World Health Organization, otherwise known as WHO, states 90% of the worldwide population has been diagnosed with type 2 diabetes? And unfortunately, this number continues to grow. Of that 90%, 1.5 million of the people who are diagnosed yearly are Americans. That is approximately around 10.5% of our population. In 2017, diabetes alone was the seventh leading cause of death and has had an estimated cost of $237 billion in direct medical costs per year. As you may already know, insulin is a hormone that helps the sugar that we get from our food to enter into our cells and is a vital hormone that everyone needs. When you have type 2 diabetes, your body begins having trouble using or making enough insulin that you need to regulate the sugar that is in your bloodstream. Therefore, it can build up and cause high blood sugar. In order to treat this condition, the physician may prescribe medication taken by mouth or an injectable medication such as Ozempic. There are also cases where both types of medications are prescribed in order to help release the insulin that is needed in order to lower the blood sugar. The symptoms of high blood sugar can consist of the feeling of being hungry and thirsty all of the time, exhaustion, itchy and dry skin, and frequent urination. In 2018, the Federal Drug Administration approved the Ozempic pre-filled injection pen, and it soon became one of the top diabetic pre-filled pens to be marketed and one of the #1 prescription drugs prescribed by the physicians. So what exactly is Ozempic? Ozempic is an injectable non-insulin medication that is used to treat people with type 2 diabetes and is administered once a week. The specific date to administer the injection is left totally up to the patient, and that date can be changed as long as there is a 48-hour waiting period between the injections. Since the targeted market for Ozempic is individuals with type 2 diabetes, just some of the benefits of using Ozempic is if it's combined with regular exercise and the individual follows a specific diabetic diet such as an ADA 1800 calorie diet, the patient will begin to see improvements in their blood sugar levels and their hemoglobin A1Cs. Not to mention that even though this is not a weight loss medication, studies have shown a 12-pound weight loss over a 12-month period on some individuals. The other great benefit of Ozempic is that it may reduce cardiovascular issues such as heart attacks and strokes and even death in adults with known heart disease. Ozempic can work in several ways. It helps stimulate the insulin that is released in order to lower the blood sugar. This can be done by reducing the amount of sugar that is released by the liver, or it can slow down the rate that the food that has been ingested leaves your stomach. When you receive your Ozempic pen from the pharmacy, it will come in a box with very helpful and very easy to follow instructions on how to set the pen up and do the actual injection. I have outlined a step-by-step instruction on how to properly set up the pen for the use on this slide. And because this pen contains medication, it must be kept refrigerated. As with all medications, not everyone can use Ozempic, such as individuals with type 1 diabetes or those who have experienced diabetic ketoacidosis. That's a condition where the blood sugar can go well over 500 and can cause a diabetic coma or death. But the most common and yet serious side effects are chances of thyroid cancer, lumps or swelling in the neck, shortness of breath, changes in vision, low blood sugar. That's just to name a few. One of the main advantages of using this injection pen instead of an oral medication such as metformin is the patient only has to do the injection weekly instead of daily. Even with the listed possible side effects that may occur, many individuals do choose the Ozempic injection pen because most of the minor issues are a little less severe than the ones that can be experienced through some of the oral medications. One of the best marketing ideas presented by Ozempic in their website. Just at a click of the button, it helps a patient to not only find help if they can't pay for their medication, but they also provide other helpful resource information and provide a telephone number if the patient still has unanswered questions. But because of the rising numbers of type 2 diabetic patients, most major insurance companies, including Medicaid and Medicare programs, do cover the medication, but still may require prior authorization before paying their share of the cost. And if the patient is unable to pay for Ozempic, they can complete an application, and if certain criteria is met, they may be eligible to receive their medication at a lower cost and pay as little as $25. Overall, this product seems to be in high demand and has so far proven to be effective in controlling diabetes and lowering the A1C levels.